This is a short video demonstrating both the hand and foot massage technique using soft and hard small balls. I'm going to start with the hand here, and I'm on a table that is about dining height. So depending on your height, you want to be able to place your hand down and then lean over to bring weight to your hand. So if you're quite a bit shorter than me, you might either find a lower table or stand on a short stool. If you're a lot higher, you might go to a uh, bar height, 36 inches instead of 30. Figure it out. The main thing is you need to take care of your wrist. So if it's too high, you're going to crunch. If it's too high, you're going to crunch your wrist. If it's too low, you're not going to be able to bring weight to your hand without bothering your back. So these maps are included in the handout. And basically you follow these points, providing pressure in the order that they're numbered. So with the hand, our first pressure point is the center of the palm. And then one at a time, we go to the number 2 pressure points, which is right under the knuckle of each finger. A precaution with this is you want to make sure you're under the knuckle. You don't want the ball to press your finger back. And then 3 is the base of the thumb, also under the bone there. 4 is on the lower part of the palm. And then 5 is on the other side from the thumb, that mound of muscle there. So the balls that I recommended you buy are quite hard. This is the larger size, a little less than 2 inches. The larger the ball, the more diffuse the pressure would be. So this ball, which is the smallest, would and hard, it would be quite painful if you were to put your whole weight on it. This one, save this one for placing between your knuckles, and I'll tell you how to do that later in the video. But so let's use this larger hard ball. I will send you a link, if I haven't already, to the website OTPT, which is physical therapy supplies. The issue is they only sell them 2 at a time. So you'd have to buy 2 of these and then 2 of these smaller size to get the whole collection. They're really not that expensive, so maybe that's okay. Plus they tend to roll away. But so you can use this now, use the hard ball as a demonstration. So the ball is in the center of my palm. My fingers and thumb are splayed outward to help center that, but also give me good balance. And then I bring my weight forward and I take a breath. I come back to release that pressure. I come forward again and breathe. Third time. Good. And then rolling it under. It doesn't really matter if you start from the small or the index fingers, but one direction or another. So this is a large ball. Just make sure all the fingers are down. And very carefully, also heel of your palm if you can. Come forward. You're going to come forward less to feel that pressure on the knuckle. I'm taking a breath each time I come forward. Especially careful with the pinky finger. And again, I'm basically doing 3 breaths on each point with the fingers. You can run through them or do 3 on each finger. Last time. And though you can't see on the camera, I'm leaning forward to add weight. I'm not pressing down, except to place as many fingers as is comfortable on the table. Good. Then 3 is this mound of muscle, but make sure you're under the bone that's under the muscle. We want to not only put pressure on muscle as a massage, we want to move our bones. Taking a breath. So if you have long fingers, long thumbs, you can place it down. Main thing is you have enough fingers down so that you're not rolling around on the ball. Leaning in and breathing 3rd time. And the last point is here. Lean and breathe. Three. So another helpful technique is to open the spaces between your fingers. And with this little hard, small ball, you basically close your fingers and then squeeze the ball. And it's as low into the knuckle joint as possible. And breathe. Release. Take another breath. Release. And breathe. And the joint between the thumb and the index is a little wider, so you won't feel it as much, but try to open that space also. So squeeze and breathe, exhale, relax, exhale. Good. We can return to the larger ball and just rubbing with light pressure, however feels good. And you can do sort of linear as well. And then we can add some other techniques. So squeezing either side of the nail bed and pulling. Can also a little hard with the thumb because the movement is angled, but with the fingers, really press down and resist, pull up and slap the finger tip down on the table. Try the thumb, but you're really putting impact on the side of the thumb. You can try other things. I haven't really figured out how to do that as well as the fingers. And then we often move our fingers to lubricate the joints, but there is a difference to having the finger relaxed and rotating it with your other hand. So there's no muscle involved except to hold the finger relatively straight. And then the other direction. You can do the thumb as well. And just observe how your hand feels. So for ease of practice, we'll do the other hand as we did the first hand. Ball on the palm, fingers down, leaning in with an exhale, releasing that pressure and inhale. And then moving to under the index, be sure of your placement. Exhale. Good. And third point is under the thumb. Exhale, add weight only as much as comfortable. 3. And then the outside of the palm. And then opening your knuckle joints. Between thumb and index. Turning to the larger ball to do some scribbling. And then linear. Set the balls aside to pinch and pull. And pressure, resist. And then passive rotation. Rest and observe. We can add to our hand care clapping. So find a good relationship to really get most of the impact here. You don't want bone on bone necessarily. And rest. So the foot care process using balls and other manipulations. For the ball massage, we follow the same processes with our hands. We use the map and we begin with the point labeled 1 and then move through the knuckles of the feet on the ball of the foot, one at a time. Then the 3, we have 2 pressure points. One is right under the ball of the foot, and the other is kind of center, a little low on the arch. And then number 4 is the outside edge, and number 5 is in front of the heel, not on the heel, but just in front of that big heel bone. So once again, using the ball that you have, the hard ball, you want to find that position, trying to find it while keeping my foot in frame. There it is. So you see it, and it would be invisible in number 1. My heel is on the floor. Very important. If you lift the heel off, the ball is going to take all of whatever weight you put forward. So the heel is there for balance and to control the amount of pressure. And you just lean forward a tiny bit as you exhale, just as with the hands. And then we move to the number 2 points, starting under the big toe. Be very careful. The toes are quite delicate, so you don't want the ball under the toe at all. You want to feel it on the bone, the joint. I mean, we don't see the knuckles of the toes, they're in the foot. Leaning forward, exhaling. And rolling to the next. The third. The fourth. Super careful at the smallest toe. And then finding the spot. So this is the spot right here, but I want to be under the foot. If I really went here, the ball would probably shoot out. So in only as far as you need to for stability. Better. And then exhaling and leaning forward as before. And we roll it down to the bottom of the arch. It's about here. It's not all the way back. And once again, I need to hide it so it's under enough so that it doesn't roll away. Heel on the floor. Exhale. And with the hard ball, be careful on this outside edge. It can actually be rather painful, but once again, see it, hide it. It should be in a good position. Exhale. And the last ball position is right. And so here the ball would be on my heel. I want it in front. And it will kind of sink in a little bit more than certainly it would sitting on the ball of your foot. Since you're so close to your heel, now your toes are down to provide control and balance. And just as we did with the hands, we want to scribble the scribble the ball over the bottom of our feet. And then do some linear massage as well, from heel to toe and back. And rest. do some manual care. So I'm squeezing either side of the nail bed and pulling. It's the snap, not the squeeze, that stimulates the meridians and the tissue. And more or less doing everything 3 times. You can do 5 if you have more time. Once usually is not enough. And then we are slapping. So resisting, pressing your toes down and slapping. Good. Then circling. I guess you are mobilizing, lubricating the joint. You're not trying to get your toes to circle bigger. Don't be rough. You can also rotate the toes very slightly, bringing that mobility back. And rest. And the other foot. Beginning with point 1, center of the foot, heel is down. Exhale. Shift forward. Exhale. And then to the number 2 points under the toes on the ball of the foot. Second toe. Third. Fourth. And small toe. And 3, find the top of your arch under the ball. So see it, hide it, exhale. And then 3/4 the way down the arch. So I can get back in frame here. Exhale. And number 4 is outer edge. And toes on the floor. Ball is, can I show this? There it is. And then as scribbling. And back and forth. And set the ball aside. Go. Pinch, nail bed, and pull. And then press your toes down and slapping. And circling. You can rotate. That's all we did with the other foot. And then sitting down, not sure how to do this on camera. Cross one ankle over one leg and slap. Slapping mostly here, slapping here. Rest. Rest and observe.